The next big question people have is, hey doc, how big can you make my buttock? And frankly, it's not usually about size, it's about shape or different kinds of volume, and everybody has different taste. So in terms of buttock size, we have to understand there's only so much fat your body will allow me to place, and there's only so much fat you're going to have. After that, it is full and will not take any more fat. So now, let's take a look at these different people, because people have different taste and different desires on shapes and volume. Therefore, we will discuss your goals and expectations, and while I cannot give you somebody else's body, I can obtain an idea of what you like during our consultation. In some, it's about shape. In others, it's about volume. While in others, it's really about both. So what limitations will I have during my surgery? Well, the first thing is that in Florida, we are limited to a 4-liter fat extraction for patient safety. This is for your safety. We cannot remove more than 4 liters, and that's about 8 pounds. Now, but not all of the fat I get is good fat. Some of it is going to be destroyed. Some fat destroys easier than others, leaving me even less fat than expected. To give you an idea of the range and variations between people, it could average between 30 to 70% of the fat that I remove is going to be good. 30 to 70%, that is a huge difference. A big, big difference. And I never know what it's going to be like until I'm in surgery, and it totally depends on your fat quality. So there are certain limitations that we have as surgeons. Some fat is resilient and does not destroy easily, so I keep more of that good fat at about 70%. Some fat destroys really easy, I only get about 30%. So as we discussed earlier, some people just don't have enough fat, and this will limit the size I can give you. Some patients wish they had more volume or a bigger buttock after the surgery, and in these particular cases, sometimes I could have you gain more weight and do a second fat transfer, but sometimes I've got to go to an implant. But we need to wait at least 3 months, in some cases up to 6 months, in order to see whether I can do another fat grafting or not. During surgery, I will place all of your fat that I obtained and place that into the buttock. I stop when I either run out of fat and there's no more fat to inject, or your body says to me, hey, I am so full I can't take any more, and it does that by squirting the fat right back at me. Now, I don't want you to worry, because getting these really big butts that people are afraid of, that takes 2 to 3 surgeries. That'll never happen. The bottom line is that I take as much fat as your body will give me, that's good fat. I transfer that fat into the buttock, and I put all the fat until I either run out of fat or your body says I'm full. Once I've reached that level, now we got to give it 3 to 6 months to see how much of the fat stayed, and we get your volume. If you want more volume after that, it's going to require a second fat grafting, and in some cases even possibly implants or a combination of both. The number of times that I've had to go to an implant is very minuscule. The majority of times I can do this with fat, but I need your help.